All right, we're going deep today
Deep in...
to the world of eye allergies,
Oh, yeah.
or as the doctors call it,
The official term.
allergic conjunctivitis.
That's the one.
And to help us get to the bottom of this,
To really understand it.
we're joined by a leading expert,
An amazing source.
Professor Dr. Suhail Sarwar.
From Lahore, Pakistan.
He's a top eye surgeon.
Yeah, one of the best.
So we'll break it all down for you today.
Everything you need to know.
What it is, the causes, symptoms,
That's right.
and of course,
The treatments.
So let's start simple.
Yeah, the basics.
What exactly is allergic conjunctivitis?
Well, it's actually more common than people realize.
Really?
Yeah, a lot of people have it.
I guess they just live with it.
They think it's normal, part of life.
Wow.
Itchy, watery eyes.
Yeah, I've been there.
But it doesn't have to be that way.
So give us a definition then.
What's happening in our eyes?
Yeah, when they get all red and itchy.
Basically, it's an allergic reaction. Your eyes get irritated and inflamed.
Okay. Because they're reacting to something harmless?
Like what?
Pollen. Dust?
Right.
It could even be pet dander.
Our own bodies attacking us.
Yeah, in a way.
But why would our immune system do that?
I know, it's strange.
Attack something that's not a threat. Right, like pollen or dust.
Well, the immune system's usually good,
It protects us.
but sometimes...
It overreacts.
So it makes a mistake.
It thinks these harmless things are dangerous.
Like they're a virus or bacteria?
Exactly, so it launches an attack,
Makes sense.
even though it's not needed.
So my immune system thinks pollen is the enemy.
That's one way to put it.
No wonder my eyes go crazy in the spring.
That's a common time for it.
All the pollen in the air.
But it's not just pollen.
You said that?
Dust mites, pet dander, even some eye drops.
Eye drops can cause eye allergies.
Some of them, yeah.
Wow, I didn't know that.
It's the preservatives in them.
Interesting.
And it's not a full body attack.
What do you mean?
It's specific cells in your eyes. Mast cells,
Mast cells? I've heard of those.
they're the ones that sound the alarm.
And release histamine.
Exactly.
Histamine, the allergy troublemaker.
You could say that.
So what are the symptoms then?
What should people look out for?
Yeah, if they think they might have eye allergies.
Well, itching is the most common one.
That's what I always get.
It's really the telltale sign.
My eyes get so itchy.
But you might also get redness,
Okay.
watery eyes,
Yeah.
and sometimes a burning sensation.
That sounds awful.
Some people even get swollen eyelids.
Oh, wow.
So there's a range of symptoms.
And some people only have them seasonally.
Right. Not everyone has them year-round.
So lucky them.
Well, it depends on the allergen.
So, like, pollen is seasonal.
Yeah, in the spring, usually.
Right, trees and flowers.
But dust mites, those are year-round.
I see.
So if you're allergic to those,
You're in trouble.
your symptoms might never go away.
Wow, that's tough.
It can be.
So for those of us with year-round allergies,
What can we do?
yeah, besides stock up on tissues.
Well, avoidance is always the best strategy.
Okay, but how do you avoid dust?
It's not easy, but you can minimize exposure.
Like how?
Special air filters,
Right.
cleaning regularly.
Okay, makes sense.
And then there are medications.
Like eye drops.
Exactly. They can help a lot.
Are there different kinds?
Oh, yeah, several types.
I've seen a bunch at this store.
Some are antihistamines.
To block the histamine.
Right, they provide quick relief.
And then there are mast cell stabilizers.
Those work differently.
How so?
They prevent the histamine release.
So they're more preventative.
Exactly. They take longer to work.
But they stop the reaction from happening.
That's the idea.
Interesting.
It's like a long-term solution.
So you could use both kinds of drops.
It depends on the person.
Right. And their symptoms.
Exactly. Talk to your doctor.
They can figure out the best approach.
That's right.
And what about steroid eye drops?
Those are from more severe cases.
They're stronger.
Yeah, they reduce inflammation.
But they have side effects.
That's why they're not for long-term use.
Okay, so they're like the last resort.
In a way, yeah.
Now, I've heard about a new treatment.
Oh, yeah.
Something called a dexamethasone insert.
That's a mouthful.
It sounds pretty high-tech.
It is. It's a tiny capsule for your eye.
A capsule?
Yeah, like a time release thing.
Oh, wow.
The doctor inserts it.
So it's not something you do yourself.
No.
It's a procedure.
And it releases medication over time.
For weeks, actually.
Directly to your eye.
Right where it's needed.
That's amazing.
It's shown really good results in trials.
So it's effective.
It seems to be, yeah.
Is it for everyone?
And not necessarily.
Again, talk to your doctor.
They'll know if it's right for you.
That makes sense.
It's not a one-size-fits-all solution.
But it's promising.
Definitely.
I'm going to ask my doctor about that.
Good idea.
So, besides drops, what else can we do?
To soothe those itchy eyes.
Yeah, any home remedies?
Cold compresses can help.
Really?
The coolness reduces swelling and redness.
Yeah, it constricts blood vessels.
Interesting.
And artificial tears are good too.
I use those all the time.
They lubricate the eyes.
And rinse away allergens.
Exactly.
Okay, so cold compresses for quick relief.
Right.
And artificial tears for ongoing comfort.
That's a good way to put it.
Does the type of artificial tears matter?
It can, especially if you have dry eye.
Ah, that makes sense.
If you're already dry.
The allergens will irritate you more.
Exactly. So look for specific drops.
For dry eye.
And here's a tip.
Okay, I'm listening.
Get preservative-free drops.
Why is that?
Some preservatives can actually make it worse.
You're kidding.
I know, it's counterintuitive.
You're trying to help your eyes.
But the drops themselves could be irritating them.
Wow, that's crazy.
Especially if you use them a lot.
So preservative-free is the way to go.
If you can find them.
Yeah. All right, I'll keep that in mind.
Good.
So we've covered the basics here.
The foundation of eye allergies.
But we're going deeper in this episode.
We're going cellular.
It's all right, the microscopic level.
What's really going on in there?
So stay tuned for that.
It's going to get fascinating.
It always does on the deep dive.
That's why we're here.
All right, so we've got the basics down.
The foundation of eye allergies.
But this is the deep dive.
We're going deeper.
That's right, we're going cellular.
To the microscopic level.
What's really happening in our eyes?
When those allergens attack.
It's all about inflammation, right?
Yeah, it's a complex process.
With all sorts of cells involved.
And signaling molecules.
We talked about histamine.
That's a key player.
But there are others too.
Like cytokines.
Cytokines. Okay.
They're messengers.
Between cells.
Right. They tell the cells what to do.
And in this case?
They send out the attack signal.
So the mast cells release histamine.
And other inflammatory substances.
Oh, well, it's like a chain reaction.
Exactly, a cascade of events.
And what about those lipid mediators?
You remember those?
Yeah, you mentioned them earlier.
They're like the regulators.
Of inflammation.
Right, some promote it.
And some try to resolve it.
It's a balancing act.
So it's like a battle in our eyes.
A microscopic battlefield.
Between the pro-inflammatory forces.
And the anti-inflammatory ones.
And whoever wins determines our symptoms.
Exactly. How severe they are.
Wow, that's incredible.
It's amazing how the body works.
Even at the smallest level.
It's all connected.
Speaking of connections, you said that dry eye can make allergies worse.
Oh, absolutely.
Can you explain that a bit more?
It's a two-way street, actually.
How so?
When your eyes are dry, allergens can stick around longer.
They have more time to irritate.
Exactly. And the inflammation from allergies
can make dry eye worse.
It disrupts the tear film.
So it's a vicious cycle.
One problem feeds the other.
So if you have dry eye,
managing your allergies is crucial.
And vice versa, I guess.
Right. It's all connected.
You mentioned some specialized devices.
For detecting corneal changes.
Yeah, those sound pretty high-tech.
They are. They're quite amazing.
Can you tell us more about them?
Sure. One is called the ORA.
ORA.
Ocular Response Analyzer.
Catchy name.
And the other is the Corvus ST.
Okay, and what do?
They measure corneal biomechanics.
Biomechanics.
Basically, how the cornea responds to pressure.
I don't quite get it.
So in dry eye or keratoconus.
Keratoconus, that's the corneal condition.
Right, where the cornea thins and bulges.
That sounds serious.
It can be, if left untreated.
Okay, so back to the devices.
They can detect subtle changes in the cornea.
Before you can even see them.
Exactly, they're very sensitive.
So they're like early warning systems.
That's a good way to think about it.
For corneal problems.
Right. The sooner we detect them,
the better we can treat them.
And preserve vision.
That's incredible technology.
It's changing the way we practice.
Man, we've talked a lot about allergens.
The triggers of eye allergies.
But are all allergens created equal?
That's a great question.
Like, is all pollen the same?
Not at all.
Really?
Different plants release different pollen.
And some are worse than others.
Definitely, some are more allergenic.
So it's not just the amount of pollen?
It's the type of pollen, too.
That makes sense.
Some people are allergic to tree pollen.
Like birch or oak?
Exactly. Those are common ones.
Others might be more sensitive to grass pollen?
It really varies.
So knowing your triggers is important.
It's key to managing your allergies.
Is there a way to track pollen levels?
Like a weather forecast for allergens?
Yeah, something like that.
There are websites and apps that do that.
Really? That's amazing.
They tell you the pollen count for your area.
So you can plan accordingly.
Exactly. Avoid going outside on high pollen days.
That's so helpful.
It can make a big difference.
I'm going to download one of those apps right now.
Good idea.
Any other tips for high pollen seasons?
Keep your windows closed.
Especially when?
Morning and evening, that's when pollen is highest.
Okay, good to know.
And when you come back inside,
yeah,
Wash your face and hands.
To remove pollen.
Right. It can stick to you.
That makes sense.
Simple things can make a big difference.
Now I'm thinking about contact lens wearers.
Yeah, they often struggle with allergies.
Can allergies make it hard to wear contacts?
Absolutely.
How so?
When your eyes are inflamed, contacts can feel uncomfortable.
They rub against the eye.
Exactly, and it can worsen the symptoms.
So what can you do?
If you're a contact lens wearer,
Do you have to switch to glasses?
not necessarily.
There are other options.
Talk to your eye doctor.
About what?
Switching to daily disposables.
Ah, so you get a fresh lens every day.
Right, no allergen buildup on the lens.
That's smart.
And lubricating drops can help too.
The artificial tears we talked about.
Exactly, they rinse away allergens,
And keep the eyes comfortable.
especially those formulated for contact lenses.
Good to know.
Contact lens hygiene is crucial with allergies.
All right, I'll pass that along.
Please do.
Now let's talk about the gut microbiome.
Ah, yes.
That was a fascinating topic earlier.
The connection between the gut and the eyes.
It's amazing to think about.
That our gut bacteria could affect our eye health.
Can you tell us more about the research?
It's a hot area of study right now,
So there's a lot we don't know yet.
but we're learning more all the time.
What have scientists discovered so far?
That the gut microbiome interacts with the immune system,
Throughout the body.
including the eyes.
So it's not just a local thing.
It's a systemic connection.
Wow, that's mind-blowing.
I know, it's incredible.
And what about imbalances in the gut microbiome?
We call that dysbiosis.
Dysbiosis. Okay.
It can lead to an overactive immune response.
And make us more prone to allergies.
Exactly, including eye allergies.
So if we could restore balance to our gut.
Could we reduce our allergy risk?
That's the hope.
It's an area of active research.
What kind of research is being done?
Some studies are looking at probiotics.
Those are the good bacteria.
Right, they can help repopulate the gut.
And prebiotics, too.
Those are food for the good bacteria.
So it's not just about what we put in our eyes.
It's about what we put in our gut as well.
That's fascinating.
It's all connected, remember?
I'm starting to see that.
It's a holistic approach to health.
What kind of foods are prebiotic?
Things like garlic, onions, leeks,
Okay, those are good for you anyway?
and bananas, asparagus.
Interesting.
Fermented foods are good too.
Like yogurt and sauerkraut?
Exactly. Those are rich in probiotics.
Okay, I'm adding those to my shopping list.
Good idea.
Now, we talked about avoiding allergens,
As much as possible.
but sometimes it's unavoidable.
That's true.
Are there any other preventative measures?
Especially during allergy season.
Yeah. Anything else we can do?
Wash your bedding frequently,
Really?
especially pillowcases.
Why is that?
Dust mites love to hang out there.
Ah, I see.
Hot water kills them.
Good to know.
Air purifiers can help too.
Those filter the air,
Right. They remove allergens.
like pollen and dust mites,
Exactly. Create a cleaner environment.
especially in the bedroom.
That's where you spend a lot of time.
Makes sense.
So those are good investments.
I'll keep that in mind.
Good.
Now, a question about diet.
Okay.
Can what we eat affect our eye allergies?
It's an interesting question.
I've heard some things.
It's an area of active research.
But we don't have all the answers yet.
But there are some clues.
Like what?
Certain foods can promote inflammation,
In the body.
and that could impact allergy symptoms,
So it's not a direct link?
but a potential connection.
Makes sense.
What kind of foods are we talking about?
The usual suspects, I guess.
Processed foods, sugary drinks,
Right. Those are bad for you anyway.
foods high in saturated and trans fats
Okay, so a healthy diet.
could potentially help with allergies.
It's good for everything, really.
That's true.
Now, one last thing before we wrap up.
Yeah.
Stress.
Ah, yes.
Can stress make eye allergies worse?
Absolutely.
Really?
Stress weakens the immune system,
So we're more susceptible to everything.
including allergies.
Wow, that's not fair.
I know, it's tough.
But it makes sense.
When we're stressed, our bodies release cortisol,
That's the stress hormone.
and it can trigger inflammation.
So it's a vicious cycle.
Stress, allergies, more stress.
Exactly. It feeds on itself.
That's why managing stress is so important,
For overall health.
and for managing allergies.
So find healthy ways to cope.
Exercise, meditation, spending time in nature.
Whatever works for you.
Exactly. Find your stress relievers.
That's great advice.
I try to follow it myself.
All right, we've covered a lot of ground here.
A lot of information about eye allergies.
Causes, symptoms, treatments.
Even the gut microbiome connection.
That was fascinating.
It really is.
But I'm sure there are still some questions.
Of course, always.
So let's tackle those now.
Fire away.
Okay, first one, and this might seem silly.
No such thing as a silly question.
Are eye allergies contagious?
I get that a lot.
People are worried about spreading it?
It's understandable.
So can you catch it from someone else?
No, not at all.
Phew, that's a relief.
It's not an infection.
Okay, so it's not like a cold.
Right, it's an immune response.
Your own body overreacting.
Exactly, so no need to worry about catching it.
That's good to know.
Spread the word.
Okay, next question.
Hit me.
How can you tell the difference
Between allergic conjunctivitis.
and other types of pink eye?
Yes, that can be tricky.
They seem to have similar symptoms.
There is some overlap.
So how do you know which one you have?
Well, pink eye is a general term.
For conjunctivitis?
Right, inflammation of the conjunctiva.
And there are different causes.
Allergic, bacterial, viral.
Okay, so how do you tell them apart?
Itching is a big clue.
Allergic conjunctivitis is itchy.
Very itchy, usually.
Right, that's the hallmark symptom.
Bacterial or viral pink eye.
They're not as itchy.
Not typically.
What other symptoms do they have?
More pain, grittiness.
Okay.
Sometimes a sticky discharge.
Ugh, that sounds unpleasant.
It can be, yeah.
But the best way to know for sure,
Is to see your eye doctor
they can examine your eyes.
and determine the cause.
Makes sense.
It's always best to get a professional opinion.
Now, a question from parents out there.
Okay, I'm listening.
Can babies and children get eye allergies?
Absolutely.
Really? Even little ones?
Yes, it can affect people of all ages.
Wow, I didn't realize that.
It's one of the most common eye conditions in kids.
So what should parents look out for?
Eye rubbing is a big one.
If they're constantly rubbing their eyes?
It could be a sign of allergies.
Well,
Redness, watery eyes.
the classic symptoms?
And if they complain of bitchy eyes.
Okay, so those are the red flags.
Definitely time to see a doctor.
Now, we talked about avoiding allergens,
That's the first line of defense.
but it's not always possible.
I know, it can be tough.
Any other preventative tips?
Especially during allergy season.
Yeah, any extra measures we can
Keep
take?
your windows closed.
We talked about that before.
Especially in the morning and evening.
And pollen counts are highest.
Exactly, that's when it's worst.
Okay, what else?
Wash your face and hands often.
To remove allergens
Right, they can stick to your skin.
and get in your eyes.
Exactly, so wash them away.
Good hygiene is key.
Always a good idea.
And what about sunglasses?
Those can help too.
Really?
They create a barrier for your eyes.
To block the allergen.
Exactly, like a shield.
Okay, I never thought of that.
It's a simple trick, but it can help.
I'm full of allergy tips today.
That's what we're here for.
No, one more question about contact lenses.
Sure. What is it?
Can eye allergies affect contact lens wear?
Oh, absolutely.
In what way?
Well, when your eyes are inflamed,
Yeah.
contact lenses can be uncomfortable.
They rub against the eye.
Right, and they can trap allergens underneath.
So it makes the allergies worse.
It can, yeah.
So what can contact lens wearers do?
Talk to your eye doctor.
Always good advice.
They might recommend daily disposables.
Fresh lenses every day.
Exactly. No allergen buildup.
That makes sense.
And preservative-free artificial tears.
Keep the eyes lubricated.
And rinse away allergens.
Right, we talked about those before.
It's all about minimizing irritation.
Okay, last question. Is there a cure for eye allergies?
The million-dollar question.
Can we ever be free from this misery?
I wish I had good news there.
So, no cure yet,
Not at this time.
but there are treatments
Many effective ones.
to manage the symptoms.
And improve quality of life.
That's good to hear.
And research is ongoing,
Looking for new therapies
like immunotherapy.
to retrain the immune system.
Exactly, to tolerate allergens.
So there's hope for the future.
Always.
Well, that's reassuring.
We're making progress.
All right, well, that brings us to the end.
Of our deep dive into eye allergies.
We've covered a lot of ground today.
From the basics to the latest research.
I hope you found it informative.
And helpful.
If you're struggling with eye allergies,
You're not alone.
there are resources available.
And effective treatments.
So don't suffer in silence
Talk to your doctor.
and get the help you need.
Take control of your eye health.
Well said.
It's important.
Thanks for joining us on this deep dive.
It was a pleasure being here.
And we'll see you next time.
For another fascinating exploration